Hey everyone, it's EDTalks, and I'm with Penny Gorsuch. Penny, welcome to EDTalks.
Thank you so much. It's so happy to be with you today.
I'm really excited, and I have to first do a disclaimer that I am on the board of Summa Health, and this is one of the fabulous Summa Health executives. So I'm totally biased in having Penny as a guest, but I actually, and I hope it comes through, just so thrilled, Penny, that you're at the helm of nursing and leadership at Summa Health and the things that you're doing. It's so exciting to me. And then, of course, we're going to jump into a little bit here in a second, but you're also a veteran of our military. So thank you for your service.
Yes, I am. So thank you very much.
I know. So we can see it in the background. So let's just jump right
Yes.
into it.
Yes.
And then I'll ask you to introduce yourself after we do this part. So you were a colonel in the United States Air Force, like almost like 28 some years, I think, right? Of
Yes.
service.
Yes,
Uh,
I did.
Tell us about your service and the stuff
Mhm.
that we see in the background.
Yes. So I grew up in a very small town in rural Georgia and went to nursing school in Gainesville, Georgia. And I thought, what am I going to do with my life? What's something amazing that I can do? And an Air Force recruiter came to our nursing school. I was a senior, and I thought, you know what? I might as well I'm young. I'm 20 years old. Why not? And so I graduated from nursing school from Georgia and joined the United States Air Force Nurse Corps. My whole intent was just to go in for a couple of years and then return home. But I tell you, after I got in and started serving our military, not only the active duty personnel, but we take care of their families as well. And the organization was just amazing. I saw what development you can get. And so my 3 years turned into 28 years. So over the course of 28 years, I had the opportunity to do amazing things that I would have never done. I was able to serve overseas in a foreign hospital. I've been able to do just numerous leadership development courses, which is kind of unique because in the military, you are not only your profession, which is a nurse, but you're also a military officer. So I had to complete all of the training that my Air Force, like pilots and acquisition officer counterparts had to do as well. So it really was an amazing journey, learning about what are the real true goals. And I always stick with what the Air Force's motto is. Air power, flexibility is the key to air power, but it's done with integrity, excellence, and just service before self.
I love it. Yeah, and tell us about some of the stuff we see in your background. Like you got some medals and your
Yeah, so very traditional when you retire from the military. You always want to have an American flag. And so prior to your retirement, that flag that you see behind me was flown at the state capitol in the state of Ohio. It's where I retired from. And then so it flew for a day. So you can have your flag flown in like at the national capitol or in your state. And then you have your flag, and then you also will display some of the medals that you were awarded over your military career, usually also displaying your rank from all the different ranks from where you start off. I started off as a second lieutenant and retired as a colonel. And you also display, some of the badges that you were able to earn over the years. So that's one of the main memorabilias that every retiree, whether you're an officer or enlisted, does receive upon their retirement.
yeah, lots to be proud of. That's why I was so excited when we recruited you. We got you to Sue Hell. I was like, dang,
Yes.
man, we
Yes.
got an amazing leader here.
Right.
It's a great
Well, and
experience.
that's, one of the unique things because by law, you can only serve for 30 years as a colonel. And so you really are retiring really young and you're like,
Yeah.
whoa, what am I going to do now?
Well, we're glad you're in Ohio and glad you're part of Summa Health. And your daughter, at least one of your kids, following in your
Yes.
footsteps, right? She got her
Yes.
MSN recently.
Yes. Yes.
Yeah,
I have three daughters. My oldest daughter is a lawyer and my second daughter is a nurse practitioner in cardiology. So really even followed in my footsteps. I also was a nurse practitioner, and when I was practicing and now I'm in a leadership role, I was in cardiology, cardiothoracic surgery as well. And then my youngest daughter, she's in political science. So all doing really well. And she's in her master's at Johns Hopkins.
that's awesome. And I met your husband. He's a great man as well, and great
Yes.
leader and patriot. Let's jump into one of the coolest things you're doing at Summa Health. You're doing a lot of great things, but is the nursing strategic plan. That's what really caught my eye when I heard about it at the board level. And of course, I've seen it a lot in our professional arena. Tell us about it.
Yeah. So I think it's really my background about you have to have a strategy. And so throughout my entire career, I've always sought for what's our vision of where you want your organization to go. And then once you have a vision, what's the strategy? You actually have to write it down. You actually have to take time and assess your organization to say, where are we at today and
Yeah.
where do we want to be? And then when you determine where you are and where you want to be, then you actually have to write a plan to get there because so many things happen, especially in healthcare, that can derail you. So if you have a plan, you can get back on your plan. And
Yeah.
your plan has to be specific to what is your organization's issues and what's your problems. So when I first came to Summa Health, I completed an organizational assessment and noted that we needed to work on some of our structure. So I'm really into process improvement and evidence-based practice. And in order to get your outcomes, you really do have to have good structures and good processes. And so the last 3 years at Summa Health, we worked really hard in the Department of Nursing across our entire system to pull nursing practice together and really work on the structure to support nurses delivering evidence care at the bedside or at the chair side
Yeah.
or on the phone, wherever we are, that we all do it in an evidence-based manner.
Yeah, because I think you came into a situation that's common in any hospital and health system where everything's sort of independent, run separately. So it's not consistent. The level of care, perhaps, or the processes, definitely not consistent. So you came in, you immediately identified that, and then you brought in that structure, and then that enabled you then to go from there and to start doing the evidence-based practice,
Right,
which
right.
then improved the quality, improved clinician satisfaction, improved patient satisfaction. I mean, there's no downside.
Right.
It's all
No,
a super
there's not.
win-win.
And part of my background on leadership development, I thought, well, how do I develop my leaders? You got to develop your leaders. And so over the past couple of years, we've had, formal deep dives in how do we actually do evidence best practice. We've had leadership courses that we've sent over 100 of our nurse leaders to a leadership course that ran for 5 months because, you really do. We can all be clinical experts, but people also need to be taught how to then be a leader as well. And
Yeah.
then take what are your best attributes and how do you expand upon those. And so we've really worked hard over the past couple of years to really build some good foundational skill sets. And then also one of the key things that we have done too is reinvigorated our professional governance, reinvigorated our frontline staff. And so have a very active now frontline staff, which is for professional governance, which allows the frontline nurses to be part of change, to be part of asking their questions and really supporting their input into what we do moving forward.
Yeah, I love that. That's one of the hallmarks, at least in my opinion, of the program, because, oftentimes people at the front lines, our caregivers don't feel like they have a voice and,
Right.
don't necessarily feel the why all the time.
Mm-hmm.
And in your case, you've engaged them, they're involved, and that helps everyone, make
Sure.
better decisions, higher quality care, the empathy, everything.
Right.
So I just love what you're doing. And I'm almost
Thanks.
afraid like to have you on EDTalks because we don't want someone coming in saying, hey, that's a great leader right there. We're going to, recruit her away.
Right. Well,
Mhm.
I love Summa Health. That being this has been an amazing job. It's and then we are not done. I mean, we have just like I said, over the last 3 years worked really hard on structure. So this past fall, we spent 3 months completing a SOAR assessment, and that's just really how I wanted to know what our leaders across nursing and the front line thought about where we were as an organization. What were our strengths? What were some of our opportunities? And what should we aspire to next? And what results do we really want to get? So we took 3 months. We got over 3,000 surveys returned with over 57,000 comments. And so we are in the process now. We've collated all that data, and we're in the process now of creating our next strategy for our next 3 years with definite input from our frontline staff. We are focusing on 5 opportunities that they identified, and we are really working to now make plans to make that better for our frontline staff, because everything we should be doing as nursing leaders should be to support our staff, providing the best care to our patients and always having the patient as our focus. And that's what we are doing at Summa Health.
Love it, Penny. It's an amazing time with you. Drop us with one piece of wisdom. So if you were talking, and I'm sure you've probably done this already, if not, I know it's coming. If you're talking to graduating classes of nurses, what's the one thing that you would tell them?
The one thing I would tell them is the nursing profession is an amazing profession, and there are so many different areas of experience that you can have and areas that you can work in. Just get out there, do your best, make it your passion, keep the patient at the center of everything you do. And if you find one area that, you don't really like or think, I'm going to leave the profession, don't. Talk to your leadership team, and because there may be something else that you can do, because there are over hundreds of different jobs and places where nurses are affecting patients throughout the healthcare system.
Yeah, I agree with you. I think nursing is like the bomb. I married one actually as well. So
I did not know that. That's
I married
great.
the DNP.
That's great.
She has her own clinical practice.
Yes. I also teach at The Ohio State University, and in their Doctor of Nursing Practice Executive Program, I teach leadership there. And I just love it. I think that, being a nurse leader is where I found my place as I grew up. I really tell you that formal education, certifications, very important. Yeah. And we are supporting that at Summa Health, and really, our motto is to deliver care beyond expectations. And I think our nurses are really doing that at Summa Health.
Penny, thank you for being part of EDTalks and for all that you do.
Well, thank you so much for the invitation. It was my pleasure.